proper sitting, very important. We are, by and large, sedentary, much more than we used to be. We didn't really start using chairs until the 6th century. It was really the king only that used a chair, and what we used to do was squat, which was much more difficult to do, difficult to keep squatting. We couldn't possibly squat for the hours that we now sit, and because it would be too uncomfortable. Having said that, civilizations that squat to this day can squat for much longer than we can, and we need to get back to it. And the reason we need to learn to squat is that we need to be doing our own spinal decompression, which I've talked about in another one of these small videos. What we need to go back to is the fact that discs are huge structures that do not have a blood supply. They have a very peripheral blood supply here at the outer rim of the disc, where the disc wall itself is ligamentous, but it's because there's no blood supply, and it's about 8 millimeters to get nutrients in and out of the very heart of the disc, we have to be careful that we don't tip the balance. Bear in mind that lumbar discs also break down in life earlier than any other part of our body. So what we have to do is to be careful that we don't tip that balance into happening more readily by being unaware of the factors that greatly speed up that breakdown of our discs. Now, sitting does speed it. I don't want you to see sitting as universally a bad thing, because it isn't. Discs require a very, very thorough but slowly transacted fluid exchange through the course of the day. The fluid is squeezed out, and then through the evening hours, when you lay it out horizontal on your bed, then slowly the discs take in fluid to get it back in. So you need, in a way you could say that sitting actually speeds up the evacuation of the stale products inside a disc. So it's no bad thing, don't be frightened of sitting. But the important thing is that you need to get it back, and I talk about spinal decompression in another one of these videos. But what you also need to make sure of with sitting is that there is a optimal balance between the front of the disc, the front of the vertebral segment, if you like, and the back. The front of the vertebral segment does comprise the disc. It's between it's the water-filled pillow between the bony bricks. But then you have the facet joints at the back, which are movement controllers, and they hardly bear any weight at all. You've got to bear load with sitting in such a way that you load share optimally between the front and the back compartments. If you're sitting slumped, you bring pressures to bear mainly at the front, but if you're sitting bolt upright with your back muscles working overtime, then you are compressing your facet joints much too much. This functional S-bend helps get that optimal load share between the vertebral bodies and their disc here and the neural arch, which is the facet joints. Delicate balance between the two, and in terms of getting your patients better with therapy, or even if you're a patient watching this, very advanced of you if you are, but in getting better and getting out of a spinal problem, being comfortable sitting is a huge part of effective rehabilitation. You can't afford to be uncomfortable sitting as you're trying to get a back problem better. So this optimal load sharing between front and back compartments is critical. But when the back is bad, you can't afford to be holding yourself rigid at one extreme or slumped at the other. And here again we have our graph. Sitting bolt upright is quite a stress, but so is sitting stooped forward. We need to eradicate those as much as we possibly can, so that we take those destructive forces on the spine. In a recent paper by Adams, flexed postures transfer a huge amount of compressive load to the anterior part of the disc, even without degeneration. So this is why it's so important with this pandemic of young people sitting at computers and playing with Game Boys and things from an increasingly young age, 3 onwards, hours, rather than actually being outside running around kicking a football. So we have to be aware from a much earlier age of the ill effects of sitting and deal with it. So you load the discs by up to 50% in summary, more so with slumped sitting, more so with a weak tummy, and more so with tight hamstrings. Remember, tight hamstrings roll the pelvis back, lessen your lumbar lordosis, actually increase the loading of the discs at the front. More so with a weak tummy, where you just slump, you just pile drive down onto your spinal base. And we now know that people that sit for a long time particularly get weakness of their lower abdominal muscles, which we have to take into account with therapy. But yes, there's problems down here. There's also obviously a great picture of problems up here. The crossbar of the shoulders with the head carried so far forward in front of the line of gravity and staying there for hours on end. You have to maintain that S-bend. These chairs are good. A kneeling chair is good, but a kneeling chair is only okay once you're out of pain, or once your patients are out of pain. You can see here that it's so uncomfortable sitting like that. None of us like sitting like that, because one can't get this nice S-bend. It tends to want to make you slump into a C-bend. And really this is what it's all about. Keeping this lovely S-bend, which bounces your spine along like a spring when you're walking, but it also balances that very heavy head, 5 kilos, over the centre of gravity in your pelvis as long as you're sitting. So while you're getting better, you need that help. You need good padding here to pad you out.